Deepak Sambhara, partner and retina specialist at the Eye Clinic of Wisconsin. Here are 4 tips for how to follow patients with GA in your practice. Number 1, understand that visual acuity does not equal visual function. As a patient with GA, you can have significant progression in your disease before it's ever captured by a decrease in visual acuity. So for that reason, you really want to lean in on ancillary imaging like OCT and fundus autofluorescence to follow your patients. Number 2, understand where these lesions are located. We know from interventional GA clinical trials, as well as from natural history studies, that non-subfoveal lesions tend to be more aggressive and spread more rapidly than their subfoveal counterparts. This may influence how soon you have these patients follow up with you or when you plug them in with a retina specialist or GA treatments. Number 3, understand the status of the fellow eye. It truly does make a difference for both the patient as well as a possible treating physician whether the fellow eye is of low visual potential or sees well. This could be a motivating factor for a patient to want to pursue treatments for geographic atrophy, and it also might speak to their possibilities for good compliance in the future, which takes me to number 4, which is setting appropriate expectations. Treatments for GA will not make you see better, but they will slow down how quickly the disease progresses. To put it differently, if having GA is like jumping out of an airplane and you're free falling, and when you hit the ground, that's when you lose your center vision, then getting treatments for GA is like jumping out of that same airplane, but this time you got a ripcord and a parachute. So you're still falling, but it'll happen at a slower rate. As a community of retina specialists, there still is a split on those offering GA treatments. So why do I? Well, for one, they fit an unmet need. And number 2, to me, these medicines represent hope just as much as they do the science behind them that got them their FDA approval.